you can fly.
Yep. that was just the
I have
missing piece there.
I have a son-in-law who's from Iran.
Yeah.
He gets it
Are
quite
you
frequently.
doing this one?
You know?
Or who's doing this one?
So anyway, pardon my
Because we
bad.
can just do that one first, can't we?
Yeah, we
could
can
do
do
that.
that.
That's great.
And then
What
we could
motivated
do-
you? Pretty easy. Just
Well, they're-
change?
They
Yeah,
need to be here
I've
for
had the
that.
I really
This one
goatee.
Marco's
Well, I grew
gonna
the
do,
beard
but
while
we
studying
were
for the bar
waiting
exam.
for
Yeah.
Sean.
And I just kind of kept it as a goatee
And
ever
then
since.
those
I
two.
figured
Let's do the
it's time
pink.
to
This
change
one?
it
Do
up.
the pink versus
Okay, Mary Ann.
Okay, we are going to begin the HR committee, 11:25. There's a copy of the Open Meetings Act, which is located at the entrance of the room over there. And our first item is well, let's go around and introduce ourselves. Mary Ann Borgeson, County Board.
Brenda Beadle, Deputy County Attorney.
Patrick Bloomingdale, County Administrator.
Joel Lorenz, County Finance Director.
Mike Boyle, District 1 sometimes.
BJ Morgan, District 4.
Florida up north.
Mark Kraft, I don't know where I'm from.
Chris Rogers, County Board.
Kim Bello, County Clerk.
Amber Redmond, Deputy Director. Debbie Otwell, Diane Carlson, Deputy County Administrator.
County Clerk Payroll.
Dan Ash, Douglas County Clerk.
Bill Malik, Administrative Lead, County Attorney's Office.
Larry Storr, citizen.
Okay, very good. Welcome to everyone. We're going to start at the bottom of the agenda today because we're waiting for some folks from the HR department who are closing out the open enrollment process, which ends at noon today. So my plan is to take item 5, and then we'll go to item 3. Marco, so we're moving it around a little bit on the agenda.
Oh, okay.
So item 5 is discussion regarding the 2020 wage increases for public defender, clerk comptroller, sheriff's captains, district court, and juvenile court bailiffs and other staff, the deputy county attorneys, assistant public defenders, chief deputies, community mental health center medical director and psychiatrist, and the Douglas County Health Center physicians. And so, I mean, this isn't news to anybody. We do this every year that we have to set salaries for these folks, or every time we have to set salaries for these folks. But Patrick, do you want to add any background on this or process conversations?
Right, so this is a little different because the county board has already previously approved 3% for all other county employees who are on range and step increases on the civil service pay plan for 2020. So that's already been done. It's already built into the payroll system. These need to be done, and traditionally, because we've done the same pay increase, at least as in terms of we give, let's say we get 3% for what the county board's already done for the general classification of employees. So then what we've done in the past is then we would give a 3% pool of money to the public defender, a 3% pool of money to to the public defender
And county.
and county attorney. Yeah, I'm just looking on those lists. Let's see if county attorneys on here. But
Well, it says it's not. It says deputy.
so deputy county attorneys. So okay, so that's it. So 3% pool to Don Klein, 3% pool to Tom Riley, and then they allocate that as they determine based on merit. And then the other ones, sometimes elected officials will ask for different pay increases for their chief deputies. I would recommend that we just start, let's just say the HR committee says 3% for everybody across the board for all these people, and then if elected officials want to come to the county board and say we want something different for my specific chief deputy, then that's on them to do that.
Yeah.
So you're recommending 3% for everybody on this
Right,
list?
because that would be consistent with what's already in place for the general classification employees for 2020.
Any other questions or comments with that? I think it's a good plan, and again, it's consistent with what we've done in the past, and I think we just stick with it and see what happens from there. Okay. Next, we will start with our discussion on the 2020 legislative priorities and issues. And our lobbyist will be coming in. I think he's on his way. but Marcos can get us started.
Thank you.
Pass me those down, please.
Okay, so just
All right.
to recap,
Perfect time.
there he is. Just to recap, our last HR committee, everybody got the information from what was kind of carried over and what we had talked about throughout the year. And Marcos put together the sheet in which we wanted to have, again, further discussion. And we welcome our lobbyist, Sean Kelly.
Yep.
And so, and Marcos,
There
you
were
may
20
want to,
Oh,
what's the
okay.
matter?
I'm just making sure Sean got a copy. That's all. Yeah. Cool.
Okay,
So yeah, Commissioner, do you?
no, so go ahead.
Oh, okay. Yeah. So we did meet. We in the last we had yesterday we had quite a bit of discussion about legislation, and one of the things I think that we touched on yesterday for sure was that we wanted to in this session was to be sure that we strongly oppose LB 20. That was the approval of the Public Building Commission bond, the voter approval bill. We were also going to strongly oppose 289. That dealt with the county assessor. It's not on that sheet. The county assessor having to review properties from 6 years to 3 years.
And if I may,
On a
on
rotation.
LB 289.
Yeah.
So that bill is taking a totally separate form
Okay.
than 6 to 3 years.
Okay.
LB 289 is the vehicle for school finance,
Okay.
property tax reform. So this is a big bill with Senator Linehan and Senator Groney that they'll be unveiling at the Legislative Council on November 22nd. To their colleagues, they literally started working on this in June. At one time, all local governments' property tax authority was capped. That has since been stripped out. Who knows what variation it'll take, and I think
Okay.
it'll take several more throughout the session. I know Senator Linehan's goal is to have this up very early in the session and try to get it done early. That's obviously a huge challenge. It's a huge issue. School districts would be the main entities working on it or probably opposed to it. But just for reference for the board, that bill probably won't take, the one-liner's misleading, I guess, long way of saying that.
Yeah. Okay.
Nonetheless, something
So
we'll
we'll
wanna watch.
so we will watch 289 closely. Yep.
So,
Okay.
did I understand you correctly, LB 20 is not on this list?
Yeah, so LB 20 is, we already took a position on it last session, so it's a carryover bill,
Mhm.
and the board is strongly opposed to LB 20, and so that will.
Actually, I
that will-
support LB 20.
The board opposes it.
I understand that, but
the board-
it doesn't strongly oppose it because I'm not strongly opposed to it, I'm in favor of it, so.
6 to
it's a
1.
split
The
decision.
majority.
That's not exactly strongly opposed.
6-1 is.
Okay. Yeah, Commissioner, I just follow, I guess, what the
I
board's
understand, but
resolutions are, and
if
so.
it's a split decision, that's not strongly
Oh,
opposed, that's
it's
a
not.
split decision.
Oh, okay.
I
okay.
testified in favor of this bill, and I'll do it again.
Okay, so
Right, I said that.
the majority of the board, that's
Right.
There you go.
all. Great.
Now, 289, did I understand you to say originally that we would oppose that?
289, we are in opposition to 289. It is a placeholder bill, is what we've learned today from Sean. So hopefully we will see what that version looks like when it's actually filed, and then we'll watch it closely. So the only other bill that I think that we made note yesterday that we're strongly opposed to is that LR8CA. That was a constitutional amendment to limit the total amount of property tax revenue that political subdivisions can raise. It was introduced by Senator Linehan. You know, again, we are on record very much opposed to it. Majority of the board opposes that bill, that LR.
Commissioner
So-
Duda, Commissioner Duda had a question.
Well, I just want to say, there's no strongly opposed or oppose. We're simply on record, we either support, we oppose, or we're neutral.
Okay.
So to quibble over how strongly we oppose something, doesn't matter.
Right.
We oppose it, period.
Right.
Okay.
Okay, go ahead, Mark.
All right, so commissioners, this has been a little bit revised since yesterday. There's a list that I handed out. It says it's a draft for the HR discussion only, in big red letters up top. So what I have on there is our 1, 2, 3 listed on there had the most discussion yesterday. And so I anticipate that at least 1, 2, 3, the board would want to move forward with to have a bill introduced on our behalf. But today is the day that you can give me direction on it. 4, 5, 6, we can have additional discussion on. But anyway, I tried to order them in the time was kind of allotted yesterday to them.
Commissioner Kraft?
Yeah, on the license plate issue, I like what Mike Doyle keeps saying about not having to license the sheriff office. Just have a license plate that says sheriff, and they use the card number. The police, you know, it goes on what Mike keeps pointing out as the postal system. Can that be added to that?
Sure.
I would personally like to see that.
Okay.
Yeah, yes, Commissioner, I have the research on it. I can always forward that to Sean. That would be a model off of Missouri, or Minnesota. Yeah, off of Minnesota.
Okay. Sean, did you have anything you wanted to add from this list or yesterday?
The only thing from the discussion per yesterday, I think Patrick had some thoughts on community-based aid, making that easier to spend and carry over dollars, if that's something Marcus and I can look into further, to see how that can be, those funds can be utilized better.
And I would wholeheartedly agree with that because the timing of it is it's just not workable as it sits today. And, you know, we're dependent upon our community folks to be able to get stuff up and running. And when you give them a timeline, you know, don't hold me to these timelines, but a timeline such as you get approval for them in May and you have to use them by the end of June. I mean, it's that ridiculous of a time frame. So I think we do need to, and I would wholeheartedly support taking a look at those timelines.
But I don't know how much of that is mandated as opposed to how much of that is just being decided by the crime commission.
Yeah, they have policies and procedures, yeah.
Yeah, but again, if it's legislation that has to be introduced to be able to change those timelines that they follow, because again, they're implementing them as they see fit for them, but they're not taking into consideration our providers who, I mean, when you start a program, and believe me, you know, I've watched this over the course of time many, many times, when you're gonna start a program up, I mean, you need more than just a couple months to do it, even if it's an existing program, because you still need to hire staff, you need to figure out, you know, your facilities, you know, there's a whole bunch of stuff. And again, that timeline that they're giving just is not, I think it's hindering a lot of our community providers to be able to come to the table and say, I want to be a part of this.
And I think a good example of what the model could look like is what we did with LB 446 last session, which had to do with the Crime Commission and the LB 605 funds, which are now, the strings are loosened and we can now utilize that entire fund if another county is not.
Right.
So I think we would do something similar to give the Crime Commission direction.
Yeah. Agreed. Any other comments on legislation? Okay. We will be bringing the ones that we will take a position on to the board in support or oppose those bills. And then again, we'll work with Sean to get just a senator to introduce some that we need to have introduced. And then we'll add what Commissioner Kraft said about the license plates. Okay?
So move forward 1 through 6
Yep.
to the main board, and then add on the community-based aid.
Yep. And the license
something we can work out.
The Attorney General.
Item, Brenda's asking about item 5.
You're gonna get the standard 3%, and if they want more, then they're gonna need
No,
to come.
item 5 is about the legislation requiring the state attorney general takes review of all aspects and costs of criminal prosecution, justice, and jails. Sean
That seems
Yeah.
like a challenging.
That-
That's,
Mike's
Right.
that's taking over the whole criminal justice
Yeah.
system and taking the
So-
cost off. But
Okay.
that's
I
basically what
wouldn't
it
lose
is.
any sleep over it.
They wanted to move forward out of here.
There-
Come down in a couple of weeks and put your. I don't think it's going anywhere, but it's
Okay.
basically a shot across the bow. The presentation that was done today.
Okay.
It's basically that's what it's about. Fair.
Yeah.
And I
Okay.
think there could be some consideration amongst the board. These can be legislative positions, but, you know, like Brenda points out with item 5, I mean, from a legislative bill perspective,
Sure.
that is possibly unworkable. But
Right, right. And that's why, again, from this list, it'll be narrowed down what comes to the board
Okay.
for ultimate support or opposition.
Will do.
Okay? Now we'll welcome our HR
Oh,
folks.
Mary, can I make one?
Oh,
point?
yeah.
Are you on the House of Delegates? The bar's House of Delegates?
I'm not, but we do have somebody in our office
Who?
that is.
Who's that?
Well, Mike Jensen and Ann Miller's on the Omaha bar, but the state bar, I believe Mike Jensen is still.
Okay, so the Sarpy County, there was a commissioner that's on there, and she made a point yesterday. So if he wants to, I think he needs to be in close touch with Marcos on
Okay.
some of this criminal justice stuff, because they made the point that a lot of this stuff gets to them, and they're, I'm assuming, as I say, striking it down for the technicalities of it and not understanding some of the operational piece of it. So if Mike needs to be in contact with us, so he can have some contacts to be able to tell the Bar Association where the counties are coming from. So if you can relay that, I appreciate
Sure,
it.
absolutely.
And if the HR folks would, we did introductions, and I told them that you had open enrollment wrap up, so if you want to introduce yourself.
Colleen Frederickson, I'm the Compensation and Benefits Manager at Douglas County.
Karen Butch, HR Director.
Carol Downey,
I think that was it.
Okay, great. So we will go back to number 1, and we will update on the health insurance coverage for dependents up to age 30, which, if you remember our last HR committee meeting, we found out that this was occurring and wanted to have some further discussion, and the HR has put together a spreadsheet here with some information on it, so go ahead.
Yeah, we requested a report from Blue Cross Blue Shield because I think there was a question asked the last time as to what kind of claims were being incurred by these dependents that were over the age of 26, whether they be 26 to 29 or older than 29 because they are disabled and dependent upon the employee for their support. And so the spreadsheet that you have before you came from Blue Cross Blue Shield, and in the left column it has the plan year, and then it has each month, so it's January 2017, February. And Blue Cross, we've only been with them since 2017, so they couldn't really provide us any information further back than that. But understand that even the January and February of 2017 claims probably included some from 2016 just because it takes 30 days or so to process. So basically what you see here is for 2017, the first 3 columns after the year are those individuals that are age 26 to 29 that are not disabled. There were 54 individual claimants during that year. The total claims came to 152,000, which brings it to 2,830.25 for those 54 claimants for the year. And the monthly, which is usually how Blue Cross Blue Shield refers to this information, is per individual per month, is $235.85, where, and just so you have comparison, our employee per month is $1,226.54. So these are substantially lower claims than what we see out of our active employees.
Okay, excuse me, but
Yeah.
I don't see those numbers.
Yeah, I just had to calculate those before they
Okay,
came
so
up.
say them
Yeah,
again.
so the 2,830.25, if you divide that by 12, it comes to $235.85 for 2017. And that is the per claimant per month cost of of one of these adult children being on our policies, those that are not disabled. Whereas the employee cost for one of our employees, the per employee per month cost or claim is $1,226.54
Per month.
per month. Mhm.
So are these numbers incorporated in that per employee per month?
It would be.
Okay.
Yes, that's a very good question. Thank you for clarifying. If you move over to the next set of 3 columns under 2017, you'll see that there are 7 claimants that are considered disabled. Now, some of these may be 26 to 29 in age or older, and they accrued $91,505 worth of claims, and their cost per claimant per year is $13,072. So if you compare it to just the regular employee or the regular dependent, which is $2,800 in the blue line, compared to the $13,000, as one would expect, the disabled children are costing us substantially more in our claims.
And they can stay on after 30.
Correct. Correct, as long as they have, right, they are not able to, correct. You're welcome. So if you look at 2018, which is the next blue line down, you'll see that there are 69 children with an annual cost of $36.49. And then there were 8 disabled for a cost per claimant of $24,517. There was 1 stepchild, that was covered for, their cost was $2,520.51. And then in 2019, there was a total of 60 children for a cost of $2,932.66. But I want to point that these numbers only go through September of 2019. So we're still 3 months short here. There were 6 disabled for a total of $13,736.41. And then if you look at the aggregate of the 2 years and 9 months, that bottom line shows that there were 103 individual claimants covered during this 3-year period. Some of them were covered multiple years, with a cost of $5,636.73 for the year per claimant. And then for the disabled, there were 8 for $46,258.07. So, and then on the left, it shows the total of everybody incorporated together. So this group of people is 112 over the 3 years, and the cost per year per claimant is $8,510.43, with the total claims of a little less than $1 million over 3 years.
Okay, does anybody have any questions on this? I think, Patrick, do you want to kind of summarize as to, for this year, we're not going to do anything about this just because of the timing?
Right, because we just finished open enrollment, so the decision that has to be made by the county board is for 2021 going forward, how we want to.
Right.
The one thing is, I believe the county attorney's office is working on a letter, an opinion letter that I think was requested by the HR committee, and the last I spoke with them, I think that they're thinking it will be issued sometime today. Is that accurate, Teresa?
Yes, I think it might be done already.
Oh, okay. I haven't checked my email, so, the preliminary opinion indicated, I know there was some discussion at the last meeting about possibly looking at charging a premium for those individuals who are disabled, not disabled, and not charging a premium to those who are disabled. And the initial opinion letter that I saw indicated, which I also looked at the statute, that we're not able to differentiate these two groups of people based upon the health condition, which means that if we're going to charge a premium to these individuals, we would have to charge them to all individuals over the age of 26, regardless if they were disabled or not, if the child was disabled or not.
I think that's probably fair.
So we'll just, basically everybody knew we were tabling this, but there's more conversation and discussion to happen for the following. And so once we get the county attorney's opinion and any more information that anybody wants to bring, we'll put it back on the agenda for further discussion.
Good.
Okay, thank you. Item 2 is a proposal to move all employees to arrears payroll.
Yes, and I believe, oh, good, Dan, pull out. We've had some discussions between the clerk's office and HR, probably going on now for a couple of years maybe. We are seeing a continual decrease in the number of employees that are on the current payroll. I believe we're less than 200 now.
Yeah.
Okay. And so what's happening is we're maintaining multiple payrolls and now we have about 200 employees. And it is, administratively, it's a burden for our office because we have to set up benefit plans and maintain those benefit plans both for arrears and current payroll. So it takes a lot of work on our part. Also, from my perspective, and Dan can speak to his comments, we have a lot of employees that call our office, and we have management staff that call our office, and there's a lot of confusion by the people that are doing timekeeping and also the people that are reading their paychecks. Because if they're a current employee, if they're gone the last few days of the current pay period, it doesn't show up on their paycheck that they were sick. It shows up on the next pay period. And so the employees think they're already being paid in arrears. And so we've had situations where employees feel like they've contacted our office and they're like, you're cheating me out of my time, you didn't account for this correctly. And it takes quite a bit of effort to explain to them, to show them that that isn't actually what happened. So we are discussing advantages of just moving everybody that's in the current payroll to the arrears payroll, and we can structure it so that it has very little impact on the employee whatsoever. They don't have to they don't have to go a pay period without a paycheck. There's options that are available to us so that we can make it pretty much painless. And so this would allow efficiencies in our department, and let Dan.
Well,
Dan and then Commissioner Boyle.
Sure.
What's the downside?
Oh,
Is there a problem with?
That's all right.
Just Dan and then you.
It's all good. The only thing I was going to add is eventually, I don't know when, but .com keeps talking about how we're going to move to the cloud, and just having everybody on one payroll system before that happens would be a lot more ideal. So,
Simpler.
yeah. That's all I wanted to add for the moment.
Is there any downside to this?
From my perspective, I don't believe there is a downside,
To the
Commissioner.
employees, anything?
We'll have to educate the employees and explain to them what is occurring, and we've talked about we would have to hold some joint meetings, but we're talking about a very small segment of our total population.
I think we should do it. I don't know why we wouldn't.
The other thing to keep in mind real quick is we do the building commission's payroll as well, and benefits, and there's they're not a big department, but about half of them are on current, so we'd have to run the,
same thing there.
Right, yeah, talk to your board as well.
So is it the older, longer term employees
It
who
is.
are on current?
For the most part.
So what we talked about a couple of years ago is that you would structure it so when they leave the end of their employment, then they don't get that extra paycheck that they would have otherwise gotten. So that's where it would occur, so they don't go without a paycheck now.
Correct, and there's other options that we've floated between the clerk's office and ourselves. If somebody didn't want to do that and they wanted to cash out their vacation, if they had vacation, they could do that. So there's options that we can present to the employees that we can manage because the group is just getting so small. So.
Commissioner Fred?
When did we go to the arrears pay system?
Oh, jeez.
I
It's,
have no
oh,
idea. It's a long time.
Between 02 and 05, 2005, so.
And this is,
So I'm on arrears.
I'm current. Well, I've been here since '93, so.
The average tenure for someone on a current payroll is 24 years.
So Claire's on current.
There's several people.
We're old.
Just being nice and not naming
I'm
them.
just trying to say, you know, it's gonna affect you guys.
well, but see, Karen and I have talked about, and it makes absolutely no sense to have two systems.
doesn't.
It
I know.
absolutely
I know
none.
that, I was just trying to get
And
some perspective on this.
And I mean, there's been other organizations that I've been involved with where we've had to move to this system, and you're right, there's options so that employees aren't, you know, quote, hurt or put at any level, you know, of not being able to make ends meet. So it, again, it's just ridiculous that we've been on two systems for this long of a time, so
Why did we go to the
it's
second
time
one
to
in
change
2005?
the,
It's just, when we moved to Oracle, back in
the great Oracle.
Arrears works really well because it supports time and attendance systems and absence management. And that's another reason why .com and those folks are encouraging us to make this change before we look at moving to the next version of Oracle, which, as Dan said, is the cloud version. The other thing is that it's easier for employees to understand because they know that the hours that I worked, everything is on my pay stub is reflected accurately. So, and it also allows for us to process pay increases and those types of things in a more timely manner, because if a pay increase is coming up and it's for the current payroll and we get it a day before that payroll's done, we might not be able to get it entered into the system. So there's a lot of advantages to going to the arrears.
Commissioner Boyle?
Let's do it.
Okay. Any other questions or comments on that one? Yes, Scott?
Would it be something where HR and clerk's office would be doing documentation on it? Because right now with our grant funders, like crime commission stuff, it's already a nightmare explaining to them why some of, because we have people who are on current run grants.
Yes.
And so if we just transition, we need to explain, because every time the crime commission gets new people, we have to teach them again why some people's paychecks look like this, and why some look like that, and how to align the grant periods.
Yeah,
And
that
same
makes
thing with the
sense.
city, when we're getting reimbursed from them too, we kind of still have this mess, because they've had a lot of turnover in grants too. So if there's some way we can just give them the documentation so they understand we're not trying to like.
Yes, we can definitely do that.
Good, good point.
Yeah. I hadn't thought about
Okay.
that.
Okay. Next item is discussion of the Virgin Pulse Wellness Program. Colleen?
Me. Okay, as you know, we're trying to finalize the contract for Virgin Pulse, which is bought out Simply Well and the Berry. And they are, due to the way that their portal is designed, they have suggested we change the program because they do not support the Simply Well program. There's very minor changes. One of the major changes would be is when you, to earn points, you usually click on the link to view an article. Instead of, you still will have that ability to do so, however, you will get an assignment from that article. So if it says healthy eating, it describes how to healthy eat, and then they'll, like an assignment would be, go to the grocery store and pick out healthy foods and come back and report to the portal what you did. So it's actually trying to implement, instead of just clicking in, earning those points. Another change that would happen, instead of getting 1 million steps in during that whole 250 steps in each quarter, it would just give you an opportunity to do, and give you every month you can get 7,000 steps within 20 calendar days, which is more plausible for most people to try to get the 7,000 steps instead of the 250,000 that you're supposed to do. They would also offer other nice things on their portal for healthy eating habit challenges. They would reduce the company challenges to 2 times a year, but encourage the employees to do other challenges with each other to get points that way. The other change is for the new hires. Currently, right now, when we hire an employee, if they're hired after August 1st, they only have to do the biometrics and the health assessment from August 1st, like say 2019, and then so in 2020, they'll only do the biometrics and the health assessment, and they get their 200 points. What they are proposing, and which I agree, is that if you're hired after August 1st, you have that year, 2020, to earn your points, and they're only going to make them attain 125. They will grant them the 75 to get that through December 1st, and then beginning 2021, if the contract continues, they would be like the other employees and have the opportunity to earn the 200 points and participate in the challenges like everyone else. So right now, we're just giving them 200.
And Claire is just enthusiastic.
I could tell he was smiling.
In support of everything.
Jumping at the bit, ready to start walking.
He is going to go to the grocery store and report back to this committee.
Those are some of the ideas that they had said.
Commissioner Boyle.
Can I pay you to do this for me?
Sure.
He is eating healthy. I am.
Yep.
I do know that we're trying to get the employees more involved, and we think, we're hopeful that the employee challenges is a way to get them involved with each other and kind of challenge each other to,
Claire, I challenge you to do nothing.
Well, we actually had a challenge. Remember the walk that,
Because I'm not gonna do it.
it was like walk from Douglas County to, I don't know where it was, but, and then it was, and actually there were departments who actually just made it a challenge for their own employees. So a really good one that really participates a lot in different things is general assistance. And so again, we may think about something like that because it really got people. It was like, I can't remember where it was, but it was around the world, some
yeah, it was
place,
another
you know,
place in
where
the
you had to,
country.
who's gonna get there first, or how many who even walked it and
Yeah.
got the
I
point.
think it was all Nebraska. Look it up.
So anyway, it was fun, but that would be some other stuff to look at. So, okay, so what do we need to do to move forward?
Just to prove that we can go ahead and change the program to what their suggestion is, and then they did send their comments for the contract that I forwarded to legal yesterday,
Okay.
so.
All right.
That's something I was
DJ?
gonna ask on a different subject, but I don't wanna interrupt while you're still going through this, if you're.
No, as long as the committee's okay, we'll recommend that we move forward with these changes to the program.
And it's not
I
something to
abstain.
take up now, but
This is what you can't.
Patrick will recall this, I'm sure.
Probably
We had
not,
some
but-
group that came here to tell us how much we could save on the cost of our health insurance, and they had little poker chips that they
Oh.
used as their business card. And I
Yeah.
just wanted you to think about, at some point, if we should have further discussion on that in the future. But I just remember the uniqueness of their little
Yeah.
poker chips
Yeah.
with their business card,
Yeah.
which that's unusual.
So by us implementing this and staying with Virgin Pulse and implementing the new program, Virgin Pulse will able to put it through Lockton's program to analyze, you know, the healthy activities people are doing, and they will run it against our insurance claims to see if these activities are actually helping us to lower our medical spending.
Okay.
So it's kind of, everything's kind of dependent on each other,
You
the
know, the
analytics of it.
rewards the employees get.
The rewards would not change, it would still be the 500, for the employee only, and the 250 for the spouse.
Which is the reduction in their.
Right.
Right. Okay,
Okay.
all right. Thank you.
Thank you.
That takes care of the agenda items that we had on for today. And so that concludes our HR committee meeting.
Thank you, Mary Ann.